Hi, everybody. Welcome to our Rapid Response Explainer event on Idaho versus United States. My name is Sabrina Talukdar. I'm the director of the Women's Initiative. It has been a wild 24 hours, and we are so glad that you're joining us today as we break down what exactly happened in the Supreme Court ruling on Idaho versus United States. Today, in a 6-3 decision, the Supreme Court issued its final ruling for Idaho versus United States, not a leak, the final one. And in this case, it dismissed on procedural grounds the case entirely. And it let the merits of the case go back to the Ninth Circuit Court of Appeals to be continued to be litigated. And the most important thing for us to remember right now is that emergency abortion care will temporarily be permitted under EMTALA, the Emergency Medical Treatment and Labor Act. And today, we're going to break down exactly what today's decision means for everyday Americans and really go into how this case highlights how the politicalization of the judiciary is fueling the politicization of medicine. And thankfully, I'm not doing it alone. I'd love to introduce my co-panelists. First, we have Nina Besser-Dorley, the Vice President of Policy and Strategic Initiatives at the Institute for Women's Policy Research, and Representative Ilana Rubel, the Minority Leader of the State House of Representatives in Idaho. Welcome to both of our incredible panelists. My first question for today is for Leader Rubel. In today's decision, the Supreme Court seemed to admit their procedural mistakes in this case. They vacated a stay or a legal pause that they originally issued in January 2024 that basically allowed the criminalization of medical providers in Idaho to go into effect for the first time in 2 years. I was wondering first, can you describe what happened to the average person in Idaho after the Supreme Court stay went into effect?
We had already been in a state of crisis since Roe was overturned in 2022. But as you noted, at least there had been an injunction on this one slim sliver. We still had this lifeline for emergency care in Idaho up until January of 2024, at which point the Supreme Court took this shocking and, really, really jarring step of saying, we're going to end that injunction before we even hear the case. And we're going to, allow this abortion ban to apply in all cases, even where a woman's facing a medical emergency. Things were already in a very dire state of affairs before that. We had already lost over half of our high-risk maternity specialists. We'd had 3 maternity wards shut down. We had lost a quarter of our OBGYNs from the state, even with the access to emergency care. But when they took that away, things really went to 11, and we started seeing women having to be airlifted routinely out of the state with emergency crisis. And I heard that one of the cases, by the time the woman was airlifted to another state where she could get an emergency abortion, her infection had progressed so far, she lost her uterus. So things reached new levels of horror after the injunction was stayed by the Supreme Court.
And as an elected leader who has fought for the reproductive rights for women in Idaho, how does it make you feel that the Supreme Court admitted this as a procedural hiccup? I think they specifically use words like, they essentially admit that they made a mistake. How does that make you feel?
I would expect better from the highest court of the land. We'd like to think they have their act together a little more. This was, they basically admitted that our attorney general lied in his briefing. They basically said they made this decision to overturn the injunction based on flagrant misrepresentations made in the state of Idaho's briefing, where they had essentially wildly misrepresented the state of affairs. They said that, if this injunction's in effect, doctors will be forced to give abortions against their will, that emergency rooms will just turn into dens of abortion. Things that, frankly, you would hope a court of the ideally sophistication of the Supreme Court would have seen through in the first place. It should not have been 8 months later that they realized, oh, whoops, that was all based on lies and we're going to reverse ourselves. That should have been very, very clear to them back when they were considering the briefing back in December, January of this year. So it's very disappointing that they allowed themselves to be bamboozled by such a clearly false line of argument, and that they weren't more careful when women's lives are on the line, when they unleashed havoc on the women of Idaho just through straight up sloppiness and failure to inquire properly. I'm glad they eventually saw through it, but a lot of damage was done in Idaho and to Idaho women and to the Idaho medical system in the interim.
Thank you so much for sharing, and thank you for all that you've been doing consistently for the women of Idaho. My second question, talking about the women of Idaho and all other women in the United States, is for Nina. Nina, I know that you and I are both fangirls of Justice Ketanji Brown Jackson, and I want to know, in her concurring in part and dissenting in part opinion, she explicitly states that pregnant women and medical providers will continue to suffer because the Supreme Court did not make a decision on the merits of this issue. And they essentially failed to decide if EMTALA overrides the criminalization of providers in Idaho state near total abortion ban. And my first question to you is, based on your extensive background on women's health, do you agree with Justice Brown Jackson that the Supreme Court should have decided the merits on this case?
I absolutely. I mean, I think what's happened here is that I not resolving the underlying issue. This decision is only postponing many critical questions. And in the meantime, the problems are only going to get worse. So that's really important because the court has failed to offer any real answers, any real long-term guarantees for patients or doctors. It's allowing litigation around this issue to continue in the lower courts. It's allowing the uncertainty to persist. In many places, even where bans are in place and there are exceptions, a culture of fear and litigation has created a situation where providers and hospitals are afraid to offer services. We've also, as Rep. Rubel has talked about, we're seeing not just in Idaho, practices are closing, providers are leaving, as has happened in Idaho and in many other states that are implementing bans. States are experiencing serious shortages of OBGYNs. That means that what happens here is obviously these laws and the decisions that we're seeing out of the court, like today, is they have impacts on access to abortion care. They also have impacts that are felt across a range of aspects of access to healthcare, access to maternal healthcare, access to a full spectrum of reproductive healthcare. And so when the court fails, like they did today, to make a decision that should have been something that's easy, something that should have been a clear decision, a chance to really underscore that the federal law does protect access in these most extreme of cases. When they fail to take that position, it really leaves open the potential for a lot of people to suffer the consequences.
Thank you so much, Nina. And you just brought up so well that there are far-reaching consequences of having abortion bans and, the Supreme Court not making a decision on this issue. Can you explain some of the other far-reaching consequences, like how this intersects, how, the confusion and chaos that has ensued after this case, how that affects things like maternal care, how that affects the Black maternal mortality crisis in the United States, things like that?
Sure. So one of the things, we've seen a lot written on how murky an environment these legal cases and the way that the vagueness and confusingness isn't a word, but I'm going to use it, of the abortion laws in many states, the environment that it's creating for providers, and what that in turn is leading to providers leaving states with bans enacted, and that's creating or expanding these so-called maternity care deserts. So places where maternity care, a really fundamental sets of services aren't available. And that it's particularly marked when the highly skilled providers who specialize in complex or risky pregnancies leave. And I think the last thing that any pregnant person wants to hear is that the care that they need, particularly the complex care, is only available, hours away. And so I also think it's really worth underscoring many of the states that are banning abortion were already places that face some of the highest rates of prenatal care before the Dobbs decision 2 years ago overturning Roe, and some of the highest rates of maternal mortality. So one of the things that there's before Dobbs in 2020, the states with abortion access restrictions already had a 62% higher maternal mortality rate, and they also had significantly higher rates of individuals giving birth who had no prenatal care or late prenatal care. And so, and that's only gotten worse. And as we see providers leaving these states because they don't want to operate in this environment, they are seeking places where they can provide the care that they've been trained to give without the threat of legal intervention or other penalties. These places where care is not available, this problem is getting worse. And I think every week there's new evidence coming out. There was recently a study, the second year of data from the the Association of American Medical Colleges, that showed for the second year running, residents are graduating from American medical schools are avoiding residency or trying to avoid residency in states with abortion bans. And really interestingly, that was true for folks going into OBGYN and emergency medicine fields, but also for other medical fields. People are opting to not, they don't want to live and work in the states where these bans are in place. And so I think when you take all of these factors together, it presents a really concerning future for the state of care on maternal health and also beyond. And since you mentioned, Black maternal health, I do think it's worth underscoring that we do have every reason to believe that the impacts of this decision, like other similar decisions, are going to fall the hardest on women of color, and specifically Black women. You can't talk about the maternal health crisis in this country without underscoring that it's way worse for Black women. I think maternal health rates in the US have gone up for everybody. The US has the highest rates of maternal mortality amongst wealthy nations, but Black women die at 3 times the rate of white women of pregnancy-related causes. And so when you couple that with the fact that 43% of women of reproductive age that are living in states that have banned abortion are women of color, we are creating a particularly concerning landscape for making an already catastrophic problem for Black women even worse, as we make care harder to receive, and make the barriers that people face in accessing all types of maternal health care, reproductive health care, a lot harder.
Thank you so much, Nina, for providing such a detailed answer on the far-reaching consequences of today's decision, particularly as it relates to the Black maternal care crisis and mortality crisis. I think that we don't make those connections enough with the differences between maternal care infrastructure, the mortality rate, what it means to not have OB-GYNs apply in your state. The consequences are truly far-reaching and devastating for marginalized communities. My third question goes back to Representative Rebel. And this is about an opinion that I know you and I have a lot of feelings about, but it is about Justice Alito's dissenting opinion. And to me, this dissenting opinion truly highlights how the politicization of the judiciary is fueling the politicization of medicine. He discusses, dual intent in EMTALA in stabilizing both pregnant women and unborn child, which has been explicitly refuted by the Department of Justice and the majority opinion as false. He lays out a hypothetical argument of EMTALA requiring abortions for mental health emergencies, almost laying out a plan for anti-abortion advocates to return to litigating this case in the future. I want to know, from your perspective, as someone who is an elected official and in charge of protecting your constituents and preserving reproductive rights in Idaho, what's your take on his dissenting decision?
It was terrifying, as you note. He basically wrote their brief for them the next time this comes up to the Supreme Court. But it reflected, and frankly, I've seen this in my state legislature, this total contempt for the lives and health of women, and subordinating that to fetuses. We always have this frustration that the fetus is the end all be all. Don't care so much about kids after they're born. Definitely don't care about the women that are carrying them. It's really all about that fetus, and everybody else gets thrown under the bus. And boy, was his opinion just the poster child for that view. It was just zero consideration for what happens. So women have organ failure, loss of organs, permanent infertility, completely immaterial to him, of no concern whatsoever. I think it was also maybe, not fully cognizant of the medical realities in these cases, and that a lot of these cases, we're looking at a non-viable fetus situation. So, as much as you want to, if you drive the woman to a hysterectomy, that fetus is going to be lost too. So you're not really doing any favors for the fetus by throwing a woman's health completely under the bus. But again, it just reflected wild disregard for the well-being of women. Just wasn't even factoring into his consideration, and it was chilling to see that.
Absolutely. I think chilling is the right word to describe his dissenting opinion. And one of my last questions is for both of you. I would love to know from your perspectives, what can policymakers do in the interim to protect pregnant patients and medical providers? Nina, I'd love for you to go first, please, speaking about providers broadly. And Representative Rubel, as someone who is an elected official yourself, I'd love for you to share what you think others folks in other states can do to protect people in Idaho. Nina, go ahead.
Yeah. I mean, I have a lot of feelings on this. I think the most basic and sort of glib answer is we need to pass better laws. I think obviously Idaho has one of the worst laws in the country here, but we need laws that protect and expand abortion access rather than ways to restrict it. And that's the solution here. When we're talking about mitigating harms, I think there are some ideas that we've seen in states that are potentially some innovative ways to do that. Things like telemedicine abortion shield laws that aim to protect doctors and other medical professionals in the states that have enacted them, who can then prescribe and send pills to patients in banned states, may be one of those ways. It's not a wholesale solution, but it may be a way to get some services to people who can't travel. Some legislative conversations about data privacy protections, again, to make sure that patients and providers and the data is protected. I think those are really, really important conversations. There have also been ballot measures in a number of states, as I'm sure folks know. I think 6 states have voted on ballot measures since Dobbs, and in each case have voted to choose the side of abortion access, and several more will vote this time around. Again, not a full solution because not every state has that process for citizen initiated ballot measures. But I think one of the things that this conversation underscores, though, that I think it's important to say is that not all of the problems that we've talked about today are going to be solved by preserving abortion access only around and only in the most extreme circumstances, and things like provider shortages and the helping with these legal gray areas, that those are not going to be fixed if all we're doing is keeping abortion access only in certain circumstances or only in the most extreme circumstances. So, at the end of the day, the solutions have to be policy solutions that ensure that abortion care is truly available and accessible to everyone who needs it.
Thank you so much, Nina. Representative Rubel?
Yeah, I couldn't more profoundly disagree with the courts on how we got to this place, but it is now up to voters, and it is now, has to be decided at the ballot. I don't believe that's where we should be. I believe this is a constitutional right that should apply from coast to coast. I don't believe that it is constitutional for state governments to be able to force women through involuntary pregnancy and childbirth. But alas, that is where we find ourselves in the post-Dobbs world. So that has just left state legislatures to be in an incredibly important spot. And I really appreciate everything that Nina flagged. That's exactly right. The things that blue states can do are exactly the things that she identified, providing protection and shields for providers in those states to be able to treat people in those states without fear of getting hauled in on criminal charges in states like Idaho. And we really appreciate that those havens are still there, at least until, God forbid, they pass a federal ban. But in terms of states like Idaho, thankfully, we are a place that has a ballot initiative. And I think that is our only way out of this mess. I think there is zero chance that our legislature, certainly as currently constituted, is going to fix this. We're now several years post-Dobbs. They have not allowed even a hearing on the slightest smidgen of a health exception to our abortion laws. We literally just can't even get it debated in committee. And I fear that today's decision, they're going to grasp on to give them further cover and say, oh, look, now we don't need to add a health exception because look, the Supreme Court solved this, which they absolutely did not. They could not have gone further from solving this. And moreover, they didn't even set a precedent that guides anybody in the Fifth Circuit or anywhere else where these decisions are being disputed. But I think, we are exploring a ballot initiative in Idaho. Unfortunately, it's not going to be on this year, but we're looking at 2026. So one of the things we also have to keep an eye on is not only getting that to happen, but we have to fiercely guard those ballot initiative rights, because the other side, they're no dummies. They realize that they need to crack down on ballot initiatives. And so there's a whole separate track of attacks on ballot initiative rights to make completely unadministrable signature collection requirements. And there's a lot of tricks they have up their sleeve to tank ballot initiatives. And the same attorney general who launched this attack and has been litigating this case to the Supreme Court gets to name the ballot initiatives. So we can look forward to whatever ballot initiative we give, getting a title like, an initiative to murder all babies in Idaho or something. So we have a lot of uphill battles ahead of us, even just to preserve the electoral paths for us to even be able to solve this at the ballot box. And every year they try to bring bills to shut down ballot initiatives across the board precisely so that we can't fix this at the ballot box. So there's a big intersection of issues that we have to keep an eye on, including, electoral and voting rights, in order to even have a path to fix this electorally.
Thank you both so much for your incredible detailed response. We are so grateful for your expertise and feedback, and I'd love to turn it over to the audience for questions. And we have one from Gabrielle Itzel from the Washington Examiner. Do you expect the court to take up this issue again on the merits? Is it possible that the Ninth Circuit's decision in this case would conflict with the ruling of the Fifth Circuit in the similar Texas case? Representative Rubel would love for you to take this one.
100%. And that was one of the things that Justice Jackson flagged in her fantastic statement there. This solves absolutely nothing. We've been left in limbo. And there were a couple of terrific quotes that I was going to read to you from Justice Jackson's decision. And she specifically flags the Fifth Amendment, the Fifth Circuit problem. The Ninth Circuit is notoriously more liberal. The Fifth Circuit is extremely conservative. I would bet my house that there's going to be a conflict in how those circuits come out on this question. And there's really no guidance from the Supreme Court to either circuit on what to do here. So I think this is heading back to the Supreme Court, and we will have to see who's sitting on the Supreme Court in a year or two when it gets back there. But Justice Jackson said, as of today, the court has not adopted Idaho's far-fetched theories, but it has not rejected them either. So to be clear, today's decision is not a victory for pregnant patients in Idaho. It is delay. So we are left in a state of complete limbo, not knowing where they're going to end up. And I fully expect there to be conflicts between the circuits and this to come right back again.
Thank you so much, Representative Rubel. There is a great question in the chat from Sarah Ornmahal. It says, we can assume that abortion rights will come up during the presidential debate tonight. This question I'd love for Nina to answer. What question would you want President Trump asked to nail down his position here?
I think that I think that everyone involved has made their position clear. I think President Trump appointed the justices that have been involved in the decisions that we've seen out of the court today. I think this is a critical. It's a critical issue at play in this. It's a critical issue right now. Obviously. I'm here in a 501c3 capacity, and I'm really nervous about commenting on this question. Sorry.
Sure, no problem. Representative Rubel, I'd love to ask you that same question too. What question would you love, essentially, for the debate tonight? What question would you want President Trump asked to nail down his position here?
Well, I guess, he's certainly made clear that he's proud of having been the one that overturned Roe. So I guess he's already well on record on that point. And he has already said that he thinks it's great that states are moving ahead with these abortion bans. I guess I would be interested in having him answer whether he thinks it's great that emergency abortion care is being banned in some of these states, and if he thinks it's great that there's been a loss of over 50% of the high-risk maternity specialists in some of these states, and if he is proud of the impact that this has had on the healthcare landscape for women in red states.
Incredible response, both of you. Thank you so much. We have another question for Representative Rubel. Do you know why Idaho legislatures are so opposed to protecting women's lives? Is this mindset also reflected in Idaho citizens?
That's a super great question. There is such a disconnect right now between Idaho's law and its lawmakers, and the people of Idaho at large. And I think there's a lot going on in our electoral system that leads to that. They've done repeated polling that shows over 80% of Idaho citizens want to see a health exception, at least, to Idaho's abortion laws. And in fact, a slim majority actually think that we should have legal abortion and not just something that's limited to health emergencies. So our laws are flying in the face of the stated preference, at least in these polls, of 82% of Idaho citizens. That's a pretty shocking disconnect. But I think there's a lot, but our Republican, convention just happened here at the state level. They tripled down in their platform and said that they oppose any exceptions, any health exceptions. They oppose any rape or incest exceptions. And they went a little further and said they think IVF should be banned as well. So how is this happening, you might ask? How do we have a party that is holding over 80% of the seats in Idaho, that is espousing a position that is opposed by 82% of the citizens of Idaho? And I think there's a lot going on there in terms of how the electoral system works. There's a very strong party kind of traditional affiliation in Idaho. People just don't necessarily follow positions. They don't vote on issues or positions. They're just kind of like, I don't really read the papers. I don't really read the news. I just vote Republican. My daddy was Republican. His daddy was Republican. That's just what we do. And so you end up in this dynamic where you have policy outcomes that are wildly at odds with the preference of the actual people of Idaho. This has been the challenge of my life to try to break that feedback loop. But we have found through the ballot initiative that when you can isolate an issue and just let the voters vote on that issue and separate it out from all of the weird party allegiances and loyalty that get in people's way, that you can get a very different outcome. We saw this with Medicaid expansion a few years ago when we managed to get a ballot initiative. 62% of the people of Idaho voted to pass Medicaid expansion, while strangely simultaneously, again, electing 80% majority of people who oppose Medicaid expansion. So you do see this real disconnect that I think party affiliation tends to really obfuscate people's ability to vote for the policy outcome that they actually want.
That's so
Can I
fascinating.
just add
Please go
that
ahead, Nina. Yeah.
that's echoed nationally. 86% of people nationally believe that there should be abortion access in cases of pregnancy complications. This isn't something that people find controversial. It's not something that's hard. And the Supreme Court's failure to deal with this today is at odds with where the vast majority of Americans are as well.
Thank you so much, Nina, for adding that really critical point. We have another question, Nina, that I would love for you to answer. This case is the latest example of the politicization of medicine. What concerns do you have for the future of women's access to abortion care as far-right activists continue to use the judiciary to push through their extremist agenda?
Yeah, I think we've seen that the limit does not exist, right? We've seen everything from attacks on all types of abortion care. Dobbs was just the beginning, and the idea that they were going to send it back to the states to decide was completely false. And the attacks on abortion, the full spectrum of types of abortion, and then beyond, attacks on birth control, and we've also seen attacks on IVF, and they happen legislatively. They're happening legislatively at a federal level and in the states. They're also happening and using the courts. And so, I think we have to be prepared for everything. We have to be like looking ahead at all of these potentials, and it's very scary. It's also we have to organize now to be ready for all of these different types of attacks. And I think if we can't look ahead and say, oh no, that won't happen. At this point, we know it's happening. We're seeing it happening. It's playing out in states and in courts across the country. It's bubbling up to the Supreme Court. There is not a level of extremism that they haven't been willing to hit.
Thank you so much. Yeah, please go ahead.
Yeah, I agree completely. And I mean, I think we're really playing catch up because there has been this very orchestrated effort. They have been playing 3D chess for decades on this. The Federalist Society has been cultivating judicial candidates and honestly kind of like growing them in a petri dish to get the absolute ideal super far right judges ready to go and to feed them to presidents who when they get them in office to stack the courts with people who are willing to do this. And it was very interesting when we saw that leaked transcript from Justice Alito. This is the agenda. I think there's kind of this throwback Christian nationalist agenda. They want the world to look like they think it looked like in 1950s when men were men and women were women and women were home raising the babies and they, had less power and everybody was straight and everybody was cisgender. And of course, we know that is not, in fact, what the world looked like back then, but that's a very idealized vision. And I think there's been a confluence of that with the plans and the Federalist Society and the stacking the courts to get judges who will implement that worldview. And we see it across the board, whether it's, attacks on contraception, attacks on reproductive health, also attacks on trans care, just across the board. They are using the judiciary very, very deliberately to shoehorn America back into this hyper-traditionalist model. They're frighteningly effective at this. And I think that maybe many of us on the other side were asleep at the switch. They have been plotting this since the 1980s and playing their cards very strategically to bring this about. It is coming to fruition now with the Supreme Court and with the federal court at all levels. There are folks planted in every circuit court and in district courts that share this agenda. And we're playing defense against it, but it's something to be very aware of.
Thank you both so much for providing this really important context that today's decision did not happen in a vacuum, that there is no limit to the extremism that we are fighting against, but also that this has been cooked up for a very long time and is part of a much more cohesive long-term strategy to commandeer the judiciary at every level of appellate litigation. So terrifying. We do have one question from Tashan. Curious about what happens now to people giving birth in Idaho. Is that piece of Idaho law stayed until there's a decision from the 9th? Does this mean doctors provide abortions in emergency situations? Or is that still unclear until there's a decision from the 9th Circuit?
Well, at least for now, the 9th Circuit upheld the injunction. So the court's injunction, so with a little bit of brief history on this, the day, and God bless the Biden administration for this, pretty much the day Dobbs went into effect, the Biden administration's Justice Department came in and said, stop. EMTALA has been law of the land since the 1980s. Under federal law, they have to provide emergency abortions. Judge Windmill, who is our local federal judge, agreed and said, yep, we're going to put at least a limited freeze on this until, it gets resolved by the Supreme Court, saying that emergency abortions have to proceed. The 9th Circuit, but that's, of course, a temporary thing. That's just saying we're going to, freeze this, allow it to keep happening until there's a real decision on the merits of the case. The 9th Circuit agreed and said, yep, we're going to put a freeze, allow emergency abortions to take place until this gets finally resolved. Then the Supreme Court just did such a wacky thing and jumped right in and said, nope, going to strike that down, that injunction before this case has even made its way through the courts. We're going to, end the freeze and the status quo freezer that was there. And so now the injunction should still be there. It will be in effect until there is a resolution on the merits, at least by the 9th Circuit. And so right now, really nothing there's been no hearing on the merits. It hasn't even been decided at the lowest court level. Really, the only thing that everybody's been talking about is this emergency freeze things while we figure it out question, but nobody's actually figured anything out yet. There has been a ruling on the underlying of whether EMTALA applies. So now This basically clears the way for them to have a real legal discussion about whether, who wins, EMTALA or Idaho's law. But we will have this injunction in place now until there is final resolution of that question. Again, very, very narrow injunction. Doesn't help you unless you're in an emergency room. It's a very, very narrow case. It won't help you if you have a non-viable fetus. It won't help you, if you're having an emergency anywhere outside of a federally funded emergency room. But at least that very narrow injunction will be there until there's a final resolution.
Thank you so much, Representative Rubel. That was such an excellent review of how important it is to remember that this is extremely narrow, this protection that exists, and it really doesn't protect the wide majority of pregnant patients that are seeking emergency care. We have one more question for Representative Rubel, and then I'd love to turn it over to Nina for the last question as well. We have another question from Gabrielle at Washington Examiner. With respect to shield laws, which both Nina and Representative Rubel have spoken about, how would you respond to the constitutional argument that they violate the sanctity of laws in anti-abortion states as an Article 4 challenge? Essentially, how do you respond to the idea that a shield law in one state that protects abortion violates the laws of an anti-abortion state?
That's a great question. Haven't seen it construed, but I think that generally each state gets to control the laws for what happens in their own state. So if you're a doctor in Washington, they can protect you in Washington, and they can say you cannot be arrested, you cannot be charged in Washington under our laws. Now, I don't know that there's much they can do to, if you cross the state line into Idaho, and Idaho says, hey, you mailed, mifepristone into Idaho, and delivered, and it was delivered to one of our, residents here in Idaho, and that breaks our laws. They can still probably get you in Idaho, but Idaho should have no ability to reach into Washington. So as long as you're doing your thing in Washington and you're safe under Washington laws, I just wouldn't take a vacation in Idaho if you're in that boat. I think that should be pretty consistent with state sovereignty and each state's ability to set its own laws. Now, I hate to see these wonderful doctors who are acting to save our women, have to fear interstate travel and fear that they have to be refugees who are holed up in Washington forever and they can never go on a cross-country road trip. So it's not an ideal state of affairs, but I think they should be well within their bounds of regulating activity that is occurring within the state that they're regulating.
Thank you so much. And unless folks have other questions, please drop them in. I have one last question that I would love to ask both of you. Originally, I was going to ask, what message do you have for the Supreme Court as we end this very turbulent 2023 term? But I realized that we've talked so much about the Supreme Court but really our focus is on pregnant patients and medical providers that have sworn an oath to provide care that is now being criminalized. I would love to know first, Nina, from you, what message do you have as an expert in women's health, maternal health, et cetera? What message do you have for pregnant patients and medical providers that are going through the mass chaos and confusion of this ongoing litigation?
Wow, that's actually a really hard question. I think that as folks who work in the policy space, we owe it to the pregnant patients and the providers to be in this for the long run. We need this change. We cannot rely on the courts, as I think you said earlier. We need the policy change. We need it at the state level. We need it at the federal level. Today's decision underscores that. It underscores what's going on in states across the country, and it underscores the massive range of things that are at play here, from obviously abortion access to a wide range of other care, to the fundamental control over our bodies and our lives. And I think that, as folks doing this policy work, as folks involved in either the state or the federal fight or both, We owe it to the people who this is playing out in their lives to be in it for the long haul and to see this through, however long it takes. And policy change does take time, but we owe it to those folks who are living it to be in that fight.
Thank you. And I guess first I would say thank you to our providers. And I've shared my story personally. I have a son who is alive today thanks to a high-risk pregnancy specialist. And it rips my heart out to see them chased out of our state and vilified and facing criminal charges for doing the heroic work that they do. Beyond that, I would say, since I think we're all in agreement that this is now in the hands of voters and in the hands of the electoral process, that the courts are not saving us. And so I guess my ask would be to keep speaking up. Speak up, speak up, speak up. I know everybody on this call is probably a super engaged policy wonk, but that is not the world at large. For the world at large, they're out watching American Idol or going to their kids' football game. They are not as engaged on this issue. And people have to hear it 200 times for it to sink in and for them to actually be willing to change their habitual patterns and take action. They need to hear it every day, ideally multiple times a day. So tell your stories, write op-eds, write letters to the editor, speak everywhere you can, speak to neighbors. People need to hear again and again and again the threat that this is creating to women, the gutting that it is having on our healthcare systems. In Idaho, certainly I want every single day when people open their newspaper to be reminded again with a new op-ed, with a new letter to the editor saying, oh, look, another doctor left. Oh, look what this is doing to us. Oh, another woman had to be airlifted out of state. They need to hear it so many times for it to really change behaviors. But keep telling those stories. Don't get discouraged. If you think you've told it already, tell it 50 more times, because that is how the world works. People need to hear it so darn many times. But hearing those stories will change minds in the end. And I want to thank everybody who is speaking up. Please keep doing so. It's our only hope.
Thank you both so much. Nina, I think what you said was so correct, that as folks in the policy world, we owe it to frontline advocates, we owe it to pregnant patients and medical providers to stay in this in the long haul. It is really the bare minimum of what we can do. And as you said before, there is no limit to what extremists are willing to do in commandeering the judiciary to effectuate their agendas. And Representative Rubel, this is such a great way to end on the reminder that it is up to all of us to use the tools that we have, our gifts, our stories, to ensure that, that the public determines the reach of the Supreme Court. And it's up to us to ensure that pregnant women and patients and medical providers have the ability to simply do their job and live safe and healthy lives. Thank you both so much for your incredible grace, for your profound intersectional expertise. And we are so grateful for all that you're doing. Again, thank you, Nina Besser-Dorley from the Institute for Women's Public Health, and for Representative Rubel with the minority leader from the state of Idaho. We are so blessed to have you today. And I know that I'll speak to both of you very soon, I'm sure, on the next steps that we can all do. So thank you so much again for your time. And thank you to everyone on the call for joining us at 2:15 after a very wild 24 hours. I'm hoping that there's no more leaked opinions for anyone today.